Hey, you guys, welcome to our daily practice questions. As always, I like to get into my introduction and disclaimer before starting our content. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, videos, and various content to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, with a 99% pass rate on all of our courses and a 100% pass rate with our one-on-one sessions. Now, I always like to get into my disclaimer before getting into any other material to let there's no absolutes in medicine. We treat on a patient by patient basis. So any guidelines that you see mentioned or any of my questions that I design is based on the current guidelines being tested on the ANCC as well as AANP exam. Now, if I am teaching on any practice processes, procedures, guidelines, and things that we do, I will say those things because, the guidelines will vary for those and what is currently being tested, but I will tell you on each so there's no confusion, okay? So with all that being said, let's get into question number one for today. Question number one states, a patient presents to the office for follow-up today. She has a history of osteoporosis, and the nurse practitioner is discussing weight-bearing exercises as treatment options for osteoporosis. What shows appropriate understanding of weight-bearing exercises? Is it A, swimming, B, jogging, C, biking, or D, water aerobics? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first so that you can slow down and ensure that you're answering what is truly being asked in the question. Stem of the question here states, what shows appropriate understanding of weight-bearing exercises? So, all right, we are teaching a patient who has osteoporosis on some weight-bearing exercises to complete to aid in the management and treatment of the osteoporosis, right? So, understanding weight bearing versus non weight bearing. Is swimming a weight bearing exercise? No. B, is jogging a weight bearing exercise? Yes. So, your answer is B, jogging. Biking, water aerobics are all non weight bearing. Remember, weight bearing exercises are things like aerobics, walking, jogging, running, hiking, different sporting like playing tennis, basketball, weight lifting. All of those are weight bearing exercises, okay? All right, question number two. The nurse practitioner and NP student are discussing contraindications of birth control. All of the following are contraindications of birth control except A, smoker, B, history of blood clots, C, history of alcohol abuse, or D, 35 years of age and older. Take a moment and tell me what you got. All right, so stem of the question states, all of the following are contraindications of birth control except. So you need to think about contraindications of birth control, right? So is smoking a contraindication of birth control? Yes. Is history of blood clots a history of a history is history of blood clots a contraindication of birth control? Yes, it is. Is C, history of alcohol abuse, a contraindication of birth control? Of course, we always recommend limiting alcohol and definitely not abusing it, but this is not one of the criteria of like contraindication and things that you need to watch out and caution with for birth control use. And 35 years of age, yes, that's also one of those risk factors and contraindications that we look out for. So your answer is C, because remember the stem of the question said all of these are contraindications except. So C is the answer. And lastly, question number three for today. The nurse practitioner has diagnosed the patient with trigeminal neuralgia. What cranial nerve is affected with this diagnosis? Is it A, cranial nerve 1, B, cranial nerve 5, C, cranial nerve 2, or D, cranial nerve 10? Take a moment, tell me what you got. All right. So you should just instantly know this is one of those knowledge style questions. And when you see these on boards, these are ones that you're just going to have, you either know it or you don't, right? And so I really wanted to do this because people commonly mix up these. So trigeminal neuralgia, you should think cranial nerve 5. Bell's palsy, you should think cranial nerve 7, right? Sensory and sensory neural and conductive hearing loss, you should think cranial nerve 8, right? So again, the answer here is B, cranial nerve 5, because trigeminal neuralgia affects cranial nerve 5. Cranial nerve 5. Bell's palsy affects cranial nerve 7. I get a lot of review students who mix up those two. So I just wanted to kind of put it in place so you can kind of think of that. So again, cranial nerve 5, trigeminal neuralgia. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any assistance or resources with our review book, any of our online review courses, or our one-on-one sessions, reach out to us at the Nursing Studio. Give us a call at 803 400 6864, or shoot us an email at the nursing studio, the number 1 at gmail.com, so we can help you be successful on boards as well. But as always, y'all, happy studying. Bye, y'all.